Hi, I'm Dr. Silva, and today I'm going to talk about a surprisingly controversial topic regarding the gluten-free craze, and specifically non-celiac gluten sensitivity, NCGS. I'm not here to offend anyone. There may be people watching this video who believe that they suffer from NCGS. And so I'm not here to dismiss the symptoms that those individuals suffer, and they do suffer. All I'm here to do today is to provide some facts, lay out some arguments, and I'm really not here to dismiss the symptoms that people who have problems with wheat and other grains and feel bad after they ingest those substances that happen to contain gluten maybe call into question the firm belief that people have that this condition exists and that they suffer from it. Really what I'm here to do is to exonerate gluten. So I'm going to just lay out my argument and then you guys can judge for yourselves. But first, I want to talk about fibromyalgia. Fibromyalgia did not exist when I was in medical school, not that long ago. And all the 4 years that I was in school, not once did we learn anything about diagnosing or treating this condition. And not only because it didn't exist, but also because there's no defined pathophysiology for this syndrome. To this day, the pathophysiology of this particular condition is unknown. And that's because there is no defined pathophysiology. And that's because fibromyalgia is a syndrome. And more than that, a wastebasket diagnosis. So, some definitions. The pathophysiology of a disease is not the cause of the disease. Okay, the etiology is the cause, the pathophysiology is the disease process itself. So, where the etiology causes the disease, the pathophysiology causes the symptoms. An example would be AIDS. The etiology of AIDS is HIV infection. The pathophysiology of the various rare cancers and opportunistic infections that people with AIDS develop is the damage that's caused to the immune system by that virus. Okay, so fibromyalgia has no defined pathophysiology. There's no specific underlying disease process that explains the various aches and pains and fatigue and insomnia and sometimes mood problems that these individuals suffer. And the reason is because it's a syndrome. It's not one condition. It's a variety of conditions with a variety of causes. And two people with fibromyalgia, so-called fibromyalgia, I finally come to accept the term, they don't have the same illness necessarily. They don't have the same etiology, nor do they have the same pathophysiology. And the pathophysiologies are most likely complex and multifactorial because it's not just one condition. It's not like type 1 diabetes. It's more nuanced than that. A syndrome is not an illness. A syndrome is a constellation of symptoms. It's just a bunch of symptoms that usually show up together. They don't always all show up. And there's an association. Another example that I'll give is schizophrenia. Schizophrenia is not one illness. There are numerous illnesses that we poorly understand that can cause the delusions and the hallucinations and the cognitive symptoms and the negative symptoms and the deterioration over the lifespan that we see in individuals with schizophrenia, because schizophrenia is a syndrome. So, how does this all relate to non-celiac gluten sensitivity? It doesn't quite roll off the tongue because I don't quite believe it. But so, I have nothing against syndromes. In psychiatry, we're always reclassifying things anyway. We're always giving new nomenclature every few years. We change all the names. And we really haven't acknowledged any new syndromes lately, but these are conditions that have presumably existed all along, but they were poorly characterized or mischaracterized, and now we're figuring them out. And yet, fibromyalgia, that one always seemed to be a bit of a wastebasket diagnosis. Most clinicians would agree. A wastebasket diagnosis, according to Wikipedia, is a vague diagnosis given to a patient or to a medical records department for essentially non-medical reasons. It may be given when the patient has an obvious but unidentifiable medical problem, when a doctor wants to reassure an anxious patient about the doctor's belief in the existence of reported symptoms, when a patient pressures a doctor for a label, or when a doctor wants to facilitate bureaucratic approval of treatment. The latter would include getting insurance companies to pay for medical treatment. And listen, I'm all for getting medical health care subsidized by the big insurance companies. But with fibromyalgia, at one point they were trying to put forth diagnostic criteria, something about trigger points that no doctor ever uses to diagnose that condition today. No one even talks about it. Now it's just a convenient wastebasket diagnosis. And every single case that I've seen as a psychiatrist has been psychosomatic. And that means caused or aggravated by mental distress or by mental factors. Doesn't mean imaginary. Ulcers are real, migraine headaches are real, chronic spontaneous urticaria, hives, hair loss, irritable bowel syndrome. All of these are real diseases with real symptoms. But the primary cause might be emotional distress. Now, admittedly, as a psychiatrist, there might be a selection bias. Maybe the reason that every single patient that I have ever seen that's been diagnosed with fibromyalgia has anxiety or depression is because patients with depression and anxiety go to see psychiatrists. They're coming to see me not for their fibromyalgia. So I realize that. However, there is an association between fibromyalgia and other neurologic and psychiatric conditions. And the FDA has approved 2 antidepressants to treat the pain from that condition, duloxetine, Cymbalta, and also milnacipran, as well as Lyrica. And the bottom line is that real pain that's not due to arthritis or peripheral neuropathy or other identified musculoskeletal problems gets better with amitriptyline and with pregabalin. Irritable bowel syndrome improves with antidepressants. And we believe that genetics and neurotransmitters are involved in this very complex set of diseases, plural. Irritable bowel syndrome is not really a wastebasket. It's like schizophrenia. It's something, but it's many different things. But it's not ulcerative colitis, and it's not Crohn's disease, and it's not colon cancer, and it's not anything specific. It's basically something that we can't pinpoint, which is why we call it a syndrome. And we probably never will, because it's probably multifactorial. And even in one individual who has irritable bowel syndrome, they may have an exacerbation that is due to these factors over here, and then the next time they have an exacerbation, it's due to this other set of factors over here, with the common denominator probably being the psychosomatic piece. It's worth considering. Is fibromyalgia a real thing? Yes, it's a real wastebasket diagnosis that didn't exist when I was a medical student, but it's a very convenient wastebasket diagnosis right now. It's appropriate. It gets insurance companies to pay for medications and for other forms of treatment that help patients because they have real pain and real discomfort and real disability sometimes that does get better with medication. It does get better with treatment, but it's not one condition. It doesn't have one etiology, and it doesn't have one pathophysiology. Conversely, I did learn about celiac disease in medical school, even though it's a comparatively rare diagnosis, less than 1% of the US population. But I was called upon to learn about this condition. It wasn't missed. I learned that it's an autoimmune disease that might be associated with other autoimmune conditions like type 1 diabetes or Hashimoto's thyroiditis. I learned that it's not an allergy in the typical sense. Allergies in medicine have a specific pathophysiology, there's that word again, that involve IgE molecules. And this is different. Celiac disease is an intolerance to gluten. Gluten, which actually refers to a group of related proteins that are found in grains like wheat and rye. It involves the production of autoantibodies. It's an autoimmune condition in which the small intestine and other tissues are affected in response to these proteins. Autoantibodies are formed that can attack a number of tissues outside of the GI tract. But classically, it involves an inflammatory reaction in the small intestine with symptoms such as chronic diarrhea, abdominal distension, and malabsorption. You actually get atrophy of the intestinal villi. And sometimes there's anemia and a failure to grow in children. It usually is a chronic condition that begins in childhood. To make diagnosis even more challenging, sometimes GI symptoms are mild or even absent. And sometimes there are no symptoms at all. So what about this so-called non-celiac gluten sensitivity? Well, the first thing I'm going to tell you is that it is a controversial disorder. That means that scientists and clinicians and epidemiologists are still undecided whether it's gluten that's causing the problem or some other constituent of wheat. Colon cancer is not controversial. Ulcerative colitis is not controversial. Crohn's disease, not controversial. So what is this controversy, this condition which may have been first described as far back as the 1970s, didn't become an epidemic until the gluten craze. And I call it an epidemic of public awareness, where suddenly this condition is in the public eye and everybody thinks that they have celiac disease for a while. And when that's debunked, then suddenly we begin to acknowledge this non-celiac gluten sensitivity. And so what about the patients who say, well, when I eat gluten, I get abdominal distension and diarrhea and I feel bad and I can't sleep. And then when I stop taking gluten, when I stop eating gluten, I feel better. And when I start eating gluten again, I get those symptoms again. Well, what about those people? And there are hundreds of thousands, if not millions of people who claim that. The problem is the placebo effect. The problem is that inasmuch as celiac disease, and one would think other gluten sensitivities, are chronic conditions that are probably genetic, that begin in childhood, you're not suddenly going to have all of these symptoms that you haven't had all along. And patients will say, oh, but I have had them all along. I have. And it's true, some patients with celiac disease have had these symptoms their whole lives and they never put two and two together. So it's possible. But when millions of people suddenly can't eat gluten, which they've been eating all their lives, and there's no proof that it's the gluten that's causing their symptoms other than their own sincere testimonials, we can't take that as evidence because of the placebo effect. The only way to diagnose gluten sensitivity, whether it's caused by autoantibodies or whether it's caused by some other as yet undefined pathophysiologic mechanism, is to withhold gluten, ostensibly the symptoms would improve, and then to reintroduce it, but in a double-blind, placebo-controlled fashion. The doctor can't even know about it, much less the patient. The doctor can't even know in order for us to assess whether it's really gluten that's causing it. So you give the patient gluten or you give the patient placebo and vice versa, and you see what happens to the symptoms. And that's just not practical. How are we going to do that? The patient is eating. We're not conducting a scientific trial. The patient is just eating foods, and you can usually tell when you have a cake that doesn't contain gluten, or a piece of bread that doesn't have gluten, or a gluten-free pizza. It's not hard to tell. So how on earth would you be able to conduct this gluten challenge without the patient and the doctor knowing about it? It's almost impossible. Whatever else, I can guarantee you that the vast majority of people who have been diagnosed with or who have diagnosed themselves with this condition of non-celiac gluten sensitivity have not undergone a double-blind, placebo-controlled gluten challenge. And so there just isn't any evidence that it's the gluten. Sure, maybe every time you eat wheat or barley or rye, you feel terrible and you have all these physical and possibly mental symptoms as well, emotional symptoms as well. And then when you stop, you feel better. But there could be confounding variables. It could be something else, like fructans, for example. Fructans are found in a lot of cereals and a lot of foods that also happen to contain gluten. And these are known irritants that also fire up the immune system, and they can give you symptoms. And so, again, you shouldn't be eating wheat if you have a fructan intolerance, but it's not gluten, is my point. I'm being a stickler here because how can we insist on an etiology? How can we say, oh, it's gluten. Gluten is causing this problem when we don't even have a pathophysiology? When we're saying, well, it's not celiac disease, so it's not because the gluten proteins are inducing an autoimmune reaction. It's not that. Well, what is it then? We don't know. We don't know. There's no smoking gun. So how can you implicate gluten when there's no evidence? Not a single person can say that they have undergone that kind of a trial, that kind of a rigorous trial that would prove, and even that, they wouldn't really prove it. We would use statistical analyses to say, well, it's statistically significant. It is highly unlikely that it isn't the gluten because we did a double-blind placebo-controlled trial, and they did in fact have statistically significant worsening of these symptoms or improvement of these symptoms when we either gave or didn't give gluten, as it turned out, after we opened up the trial and unblinded the trial. We don't have that. We don't have that evidence. We don't have a pathophysiology. And yet we're going to insist that this fibromyalgia of the culinary world is a real thing and that millions of people have it? That it didn't exist a few decades ago? I did a little research to try to figure out when this got started, the whole gluten craze. It started in the early 2000s, circa 2004, 2005. But it wasn't until 2011 that there was a consensus conference, first in London and then in 2012 in Germany, in which clinicians got together and diagnosticians got together, and the opinion started to shift a little bit. And there began to be greater acceptance for this notion of non-celiac gluten sensitivity. Celiac disease was elucidated in the 1950s. And in the 1970s, clinicians were able to identify some patients that were sensitive to gluten who did not have celiac disease. But in 2004, 2005, suddenly everybody and their dog was off of gluten, and everyone was being diagnosed with celiac disease. And fast forward a decade and a half later, and now those individuals that clearly do not have celiac disease, which we can prove that they don't have celiac disease because we can do blood tests and we can take biopsies. Now they can fall back to, well, I don't have celiac disease, but I have this other amorphous thing that fits very nicely. And it also explains my symptoms. Symptoms which are not free from the effect of placebo. And if all of this weren't enough, if all of that weren't enough, those facts, consider that nobody suffered from this until after the craze, after the fad. And no matter what side of the argument you fall on, whether you believe in non-celiac gluten sensitivity or whether you believe that it's just a wastebasket diagnosis that really people don't have, and it's almost certainly not the gluten that's causing their problem, whatever side of the argument you fall on there, there's no argument, there's no disagreement that it is a fad. And we know that because of the explosion of people who are talking about it and who believe they have it, and also because the merchandisers wasted no time in exploiting it. Suddenly there's gluten-free this and gluten-free that, foods that never contained gluten in the first place. I even saw this gluten-free shampoo, people. Gluten-free shampoo. What do the manufacturers think people are going to do? Drink the shampoo? And even if shampoo contained gluten, which shampoo has never contained gluten, what would rubbing it in your hair do? It's not radioactive. It's absurd. It's absurd. Even if you rubbed it into your scalp, you wouldn't absorb enough of it to get enough systemic absorption to make a difference. And I can't even believe I'm talking about gluten-free shampoo, all right? But the emperor has no clothes. We really need to look at this and see it for what it is. And even if it is foods that contain gluten that are aggravating you, it could be your microbiome. We're learning more and more about our natural flora in the intestine, the bacteria that live in our gut that affect our health in so many ways, including our mental health, including our mood. There's association between the microbiome and depression and anxiety, amazingly enough. A connection between the central nervous system and the gut. And so that's just one of many plausible explanations for why you eat this and you feel like shit. Maybe, just maybe, it has nothing to do with gluten. And so I would just encourage people to open up their minds to realize that they really don't have any proof, no matter how convinced they are that when they eat something, they feel a certain way, and when they don't, they feel another way. You have to be blinded to that, and it has to be subjected to the rigors of statistical analysis in order for us to say, yeah, it probably is the gluten. And here's the probability, here's the likelihood, the actual statistical probability of it. It's not 100%, but we can be fairly certain. So many people are convinced, and they don't even have the benefit of a rigorous design like that. And I think it's important not just to be a stickler. It's not just semantics. There is evidence that people who avoid gluten like the plague may be at higher risk for certain vitamin deficiencies. I mean, certainly children, if you have a parent who's convinced that their child has this disease, when in fact they don't, we don't need to believe that we have things that we don't have. Lastly, I just want to reiterate and to emphasize that no one doubts that people who are suffering from whatever syndromes, plural, whatever conditions masquerade as so-called celiac disease, whatever variant you're talking about. NCGS sufferers, people who identify with that particular diagnostic label, have been shown to have associated neurological disorders and comorbid fibromyalgia and psychological disturbances and neurodermatitis and other conditions that are psychosomatic in nature, i.e. caused or exacerbated by mental distress. Not imaginary. No one doubts the symptoms nor the psychosomatic associations and the related neurological and psychiatric disorders. But why are we blaming these poor little proteins that the immune system is probably ignoring? So I hope that I have at least planted a seed of doubt in your mind if you're thinking that you might have this.